All right. Well, good morning, everyone, and good morning, Alan. Thank you for joining me today. It's
Good
Heather
morning.
Chubb with the Chubb Law Firm. Once again, we're going to be talking about some resources for aging, and my guest this morning is Alan Fisher with INDECARE. I so appreciate you getting up so early in the morning, bringing your coffee with you.
My pleasure.
So, yeah, help make us smart about in-home care.
Well, listen, I really appreciate the opportunity. So looking forward to our discussion this morning.
Terrific. Okay. So tell us about some trends that you're seeing out there with aging adults.
Yeah, it's really this is always very interesting to me. It's always somewhat compelling. When I first think of the stats that we are all facing as we continue to move forward and age in place, um, as an example, there's 56 million adults that are over the age of 65 today. Pretty large segment of the population. It will turn to 70 million adults by the year 2030, which means 1 in 5 individuals in the United States will be 65 or older. 95 million adults will be over the age of 65 by 2060. The real interesting stat that I always look at is that the fastest growing part of our population is those adults that are 85 years and older. So if you think about it, we continue to live longer. We live with these more chronic conditions. So we have to really start thinking about what's going to happen for us as, each year goes by and we continue to get, just a little bit older. There are some cool trends that are happening though too. There are things like telehealth and smart home technology and automation that's hopefully helping us live a little bit, easier. We can consult with our healthcare professionals in the home a little bit more. We have these technologies and safety systems that can help us maybe a little bit more with medication reminders and fall detection. So there are technologies that are definitely emerging that I think will be helpful for people as they age in place.
Great, great. It's nice to have those things. Um, what services are you seeing that are available to seniors? I think probably with an eye toward the in-home care angle.
Yeah, I mean, so, I've been providing in-home care for the past 17 and a half years. I always like to say a little bit of home care, a little bit of support in the home goes a long way, keeping somebody safe, keeping somebody engaged, more or less having eyeballs on somebody to observe and understand if changes of conditions are happening. So in-home care is very important. And I really do like to emphasize that I think a little care can go a long way to keeping people safe and out of the emergency room, out of the hospital as the result of a fall or some other condition that happens. But it's pretty wild. There's a lot of technologies that are out there that are becoming more and more available to seniors. We talked about telehealth. There's home health services, so you can have physical therapy and some nurse oversight in the home if the doctor sees it fit and orders it. There's food delivery. We no longer have to physically go to the shopping center and, go grocery shopping. I'll tell you, my wife and I just started that program for ourselves. And the food, we ordered it in the afternoon. It showed up that same day. And it worked really, really well for us. So we're trying to take advantage of certain services that are available as well. But there's also ride sharing technologies, right? Where people no longer, if I can't drive, which is, a big loss of independence for seniors,
Mhm.
but if I can't drive, there's still opportunities for me to stay engaged in the community and, get to a lunch with my friends if I want to, get to the doctor if I need to, that, I can still stay very connected to the community based on these technologies. But home care, I always think about from the standpoint of, we help with the services that happen around a home. So it could be
Mhm.
meal preparation, it can be helping with laundry assistance, changing bed sheets, incidental transportation, all the things that people do on a day-to-day basis to keep their home operating. And then obviously if things get more complicated and I need help with getting dressed or bathing for safety reasons, that support is available in the home.
Great. So, if I was going to go visit an elderly relative, are there some things that I would want to be looking for that would make me think that maybe that relative is a good candidate for home care, or some home care might help their situation?
Yeah, there are definitely signs that we all should be thinking about and be aware of, whether it's for ourselves as we continue to get older, or whether it's for our parents or our aunts or uncles, family, friends, that type of thing. And, the first thing that I always think about is there a recognizable notice in somebody's physical decline? Meaning, have they had a recent fall or several falls? Are they having difficulty with mobility? What does it look like when somebody gets from a sit to a stand? What does it look like when somebody's walking in their home? Are they using furniture to kind of guide them, and maybe give them some stability? What does it look like when somebody goes up and down the stairs? Um, in that physical decline, what happens with somebody? Are they gaining weight? Are they losing weight? A lot of times, unexplained weight loss, though, or changes in appetite could be a sign that we really need to dig a little deeper into that. And then just signs of general chronic pain and discomfort that happens just to perform just everyday life, right? Moving around, getting in and out of the car, things like that. The
Yeah, I
second
think.
thing that we want to keep an eye on are the cognitive changes that we might notice. So, is somebody starting to have some memory loss where they're really starting to forget frequent conversations or a conversation we just had the other day? Are they having difficulty concentrating or making decisions for themselves? Is there confusion around the time, the place, people they visited with? And do we see changes in mood? Things like increased irritability and withdrawal from social activities. The third area is where you start to see kind of people neglecting their personal hygiene or care. So, poor grooming and hygiene, gosh, I noticed my mom hasn't bathed in the last couple of weeks. She was in the same clothes that she wore the last time and they were dirty. Things like that. Unkept living conditions. Is the home full of clutter? Is it dirty? When I go to the refrigerator, are there expired food items there that maybe are still being eaten? Those are things that really are signs that we have to start to think about. How do we get some assistance and support? And then there's the medication mismanagement, right? Somebody's forgetting to take their medications, or they're maybe taking too much of their medications. They can't really explain what they take when and how the doctor has ordered it. So it's really important to understand that. The fourth area is safety concerns. So just general difficulty in completing household tasks, things like cooking, cleaning, and shopping. Does somebody forget to turn the stove off? Or did somebody leave the water running, to fill the pool? Those types of things are definitely indicators that, there might be something going on that we really need to, hey, let's bring some support services in the home.
Great. Those are all good ones, really good ones. So, we've talked about bringing some supports into the home. Is there a point in time where support and care in the home is really not an option? And what would that look like? How would we know that home care is not the right thing anymore?
Yeah. Well, people have to recognize that, home care is a service that unfortunately is not typically, paid for by like our medical, our health plan that we have, or Medicare, typically not paid for by that. So a lot of families, when they are looking for care, they obviously have to understand the financial implication of keeping a loved one at home. So there's always that balance, right? But when it starts to become where it requires just a heavy burden, maybe by family, to start to really manage that care on a day in, day out basis, when there's gaps in care as a result of how the family was able to put together care resources for that loved one, then I do think that people have to really explore and understand what options are available to them. And those are, there's a lot of wonderful options out there for families. It's hard a lot on aging adults because a lot of aging adults, they dig in and they say, I want to stay at home. That's my preferred method. And that's wonderful. You could do that with in-home care for sure. Or you can have a family caregiver that helps participate. But you can participate maybe in a program like adult daycare that helps relieve some of the burden of, family and, the need for in-home care on a day in, day out basis. But once that happens and we now kind of cross this plateau of, okay, it's getting complicated, to a pretty high degree, then we start to look at maybe some other residential community living, such as a board and care, which are 6-bed residential homes that are licensed to help and support the elderly. There's traditional assisted living and memory care that are really wonderful options for people to age in place.
Right. Okay. So let's talk about, this is kind of the elephant in the room. What financial resources are required for home placement? Like, how much does this cost? You talked about maybe there's a financial burden as the care needs increase, because you can provide 24/7 care in the home, right? That is
Absolutely.
a possibility. But tell us about the price tags that kind of come with some of these things.
Yeah. So, first off, we have a lot of families where their choice and preference is to stay in home, and they
Mhm.
do so whether it's with, you know, 20 hours a week of care, 40 hours a week of care, or 24 hours a day, 7 days a week. Now, in order to do that, again, you have to have financial resources to be able to do that. When we look at the Sacramento market, the typical, I always call it the bell curve, where, 80% of the home care providers fall. You'll typically see that $38 per hour to $42 an hour kind of cost range. So, again, you can do the math, but when you have, 20 hours of care, it's more affordable than having 24 hours of care 7 days a week. Families that have the resources and want to stay at home, they're able to do so. Like everything else, you have to look at your budget. How much income do we draw? What's our expenses? And then if we have to supplement that, are there things that we have done? Did we seek out long-term care insurance many years ago? So can that help us? Are we a veteran where we might be able to receive some benefits from the VA? There's other programs, that are available that can offer income gap opportunities, such as, reverse mortgages, and a wonderful program called HICM that we've spoken about before.
Yeah.
So what I think is that it's really important to understand kind of where those resources are and start to plan. Educate yourself, understand what those cost parameters are, understand where there might be gaps, and look for ways to possibly fill that with some of these other sources.
Great. Perfect. Perfect. Alan, I think we are at the end of our time today. So I want to thank you for joining me again bright and early in the morning. And to our audience, if you or a loved one thinks that they need some care and would like to stay in the home, please reach out to Alan at INDECARE. He is a wonderful resource in our area.
Thank you, Heather.